Thank you for staying with us. We kickstart our big stories this morning, and our panelists will review major issues that caught our attention in the course of the week. We'll talk about COVID-19 expenditure accountability as the finance minister delivered in Parliament, and the speaker saying the finance and health committees should investigate the matter further. We'll also look at food security, and as the CEO of the buffer stock company, Abdul Wahab Hanan, is attributing the shortage of food and hike in prices to an artificial shortage. We'll also explore a bit about the Okada business and operators in Accra revealing that some pillion riders, despite the risks they are exposed to, are refusing to use the crash helmets for fear of contracting COVID-19. We'll be getting the details from our guests this morning. Dr. Osai Kwapong is a CDD fellow. He joins the conversation. Samuel Bing is with the Parliamentary Network Africa. We also have Dr. Charles Nyaba, President of the Peasant Farmers Association. Edward Karewe, as we know, General Secretary of the General Agricultural Workers Union. And Cecil Gabra, Dr. Michael Owusu, a virologist at the KCCR. Cecil Gabra, of course, is a roads and transport expert. So let's get into the nitty-gritty now with Michael Owusu, who is a virologist at the KCCR. Let me start with you by inquiring, are you surprised that we're seeing another surge in the COVID, what some people say sixth wave, fifth wave, and all of that? But especially on the back of the 28th address of Mr. President, concerning easing of restrictions and allowing mass gatherings and not being obligatory to use masks and all of that. Is there any linkage? Are you surprised that we are where we are again, facing a spike in the figures?
Good morning to you, and good morning to all your viewers. For me, I'm not surprised. I'm not surprised because I knew we will get to this point because of the behavior of the virus, how it goes about what it does. If you have followed the trend, you get to understand that every wave does not just come like that. It comes as a result of changes in the nature, characteristics, and properties of the virus. Within the first wave, you are very much aware that we had what we call the UK variant or the Alpha variant. In the second wave, we had the South African one, which was the Beta variant. In the third wave, we had the Delta variant from India. Then in the fourth wave, we had the Omicron, which was also first detected somewhere in South Africa. So currently, what we are experiencing is that Omicron has now about 5 sub-lineages. The lineage 1 and 2, what we call the BA1 and BA2, are the ones that contributed to the fourth wave. And across the globe, we have now the B4 and the B5, which are very much, so much transmissible, almost 70 times what we knew for BA1 and BA2. So, if you have a virus mutate and then is able to attain that high level of infectivity, you can already predict that this is what will contribute to the next week. Talking about the restrictions and the easing of restrictions announced by the president a couple of months ago. Ideally, if you have the numbers going down, and numbers come to zero, like we recorded, it is in place to put in policies and measures that will allow for people to have free movement, engage in activities and interact and do what it's supposed to do. But as soon as you have numbers beginning to spike, especially when you have records of these variants detected in country, what it means is we need to revisit these kind of pronouncements and relook at how to model this. Especially the question of the use of masks. The president mentioned that people are encouraged to use masks, but you see a difference. When you encourage people as against making it mandatory.
Exactly.
When the word
because even when it was mandatory, people were flouting the rules. Even when we were obliged to do it, some people would still not do it. Now that you ease it, then I don't know. I think it was in Bono East or Bono region where, the regional health director was complaining bitterly about the fact that people were simply, it had basically come to zero.
Exactly. Even in the healthcare facilities where you will expect that people who have knowledge of this COVID will pay particular attention and be more careful even for patients who visit their relatives. I mean, for the public who visit their relatives, they don't care. And if you tell them to put it on, the next thing they will tell you is that the president said it's not compulsory. So we need to look at this in the heat of this fifth wave. And I think that mask wearing is one of the key things that we have to, once again, go back to the earlier pronouncement and then, I mean, make it mandatory. I mean, it doesn't cost, it doesn't affect anybody to say that mask wearing is mandatory. Sanitizers, you remember, I mean, a couple of months ago, people have small sanitizers in their pockets, in the cars, but you don't see that anymore. Even if you want sanitizer access in facilities to sanitize your hands, you don't find them.
Right.
But not there. Even in the schools, most of the schools that used to put Veronica buckets at the doorsteps of the schools with soap and water to wash the hands of the kids when they enter and leave, they've suddenly abandoned this. So this, I mean, if you have a new variant come into a country, and then the people in the country are not strictly following through the COVID protocol. It's like petrol, and then fire. Fire.
Right.
You provide the medium for the virus to ride on. And so far as you have people that are not taking advantage of these protocols and to abide by, the virus will only increase and rise. So we seem to have given way for the new B4, B5 to run through the population. And as you have seen the numbers already going up, this is going to go up to the highest peak if we don't do something quickly to see. I mean, the only fortunate thing about this is that this B4, B5 is not that virulent compared to the Delta from India. So the possibility of causing death is much lower than the Delta variant.
And I'll have you hold it right there. Yes, we've recorded some deaths in recent times, and as for the numbers, they've just ballooned. I'll come back to you later as we look at the realities on the ground and what, like you're saying, we ought to be doing to forestall what you're suggesting, that if we don't get a grip on it, we could be laughing at the wrong ends of our mouths. But